Hello, my name is Dr. Andy Jordan. I'm a pediatrician with Cumberland Pediatric Associates. And with the arrival of spring, really, or almost to summer, families will be spending more time outdoors. This is a good time, I think, to review just some general information about ticks. We'll call it Tick Talk. Oh no, not that kind of Tick Talk. No, not that kind of tick either. I'm talking about ticks, eight-legged bugs, arthropods we call them, that must feed on the blood of mammals like us, birds or reptiles to survive. Tick bites can occur year-round, but tick activity is greatest between April and September. Ticks are generally found on the ground or in bushy or wooded areas. They can climb taller grasses, but they lie in wait in these areas for something to brush by them, and then they release and then try to find a site to attach on their new host. Now, they do not jump, and despite what your grandmother has told you, they do not fall out of cedar trees. Now, there are several varieties of ticks, but only 3 ticks in general seem to transmit diseases to humans. At least in this area. And yes, all 3 do live in Tennessee. They are the deer tick or the black-legged tick, the Lone Star tick, the American dog tick, or sometimes called a wood tick, and then there is another tick I want you to become familiar with, and that's the brown dog tick. It's important to recognize this one as well because they oftentimes actually can live in a home indoors, but they do not in general carry any kind of diseases that can be transmitted to humans. So the deer tick or the black-legged tick is pretty easily recognizable, at least the female. It has this orange kind of amber rust-colored body with a black shield behind its head. The male tends to be brown, but it's got a very dark brown or black rim around the edge of its body. The wood tick or American dog tick is a brown tick. The female tends to have a kind of a white and brown speckled shield behind its head. The male tends to have a black and white speckly kind of stripe pattern on the whole body. The Lone Star tick is probably the most easily recognizable in that the female will have a single white dot on her back on a brown body. The male tends to be brown with a little brownish white kind of speckling around the edge of his body. And the brown dog tick tends to be a solid brown. It can have more of a light colored border around the edge of its body. While there are about 20 known illnesses caused by or carried by ticks in Tennessee, the most common are Rocky Mountain spotted fever, ehrlichiosis, Lyme's disease, and starry or southern tick-associated rash illness. The first 2, the Rocky Mountain spotted fever and the ehrlichiosis, the hallmark of those diseases is persistent headache and fever, and that can happen several days to a week after the tick bite. And then the other 2, the Lyme disease and the starry illness, those are hallmarked by a rash that develops around the site of the tick bite. And that rash will usually develop several days to even a couple of weeks after the tick bite. Now, the risk of getting these illnesses just depends on which type of tick you were bit by, the time of the year, and how long the tick was attached to you. So let's talk about preventing tick bites. There are several ways that you can prevent tick bites. One is just keep your yard neat. Keep the grass cut frequently. Keep the tall grasses and brushy stuff off to the side of the yard. Keep your swing sets away from trees and brushy areas. Put up a fence to keep unwanted and wild animals that might be carrying ticks. Put a fence around your yard to help prevent those animals coming into your yard. Keep your wood stacked neatly in a dry place. Again, wood is a nice place for ticks to hide. And a word about pesticides. You can spray your yard for pesticides, but I wouldn't rely on that solely as a way to keep the ticks out of your yard. Now, when you're away from home, you go into the lake, camping, picnicking, down to the farm, there are several other things that you can do away from home to help protect yourself and your kids from ticks. One, you can use a insect spray, something like off. Anything with a 30% DEET concentration, you can spray that on exposed skin. There's a new spray called picarit with an ingredient called picaretin. You can use that up to a 20% strength and spray that like you would off on exposed skin. You can spray permethrin, 0.5% spray that can be sprayed on your clothing, on backpacks. Now this does not work if you apply it to your skin. It only works when you apply it to clothing, and that will help decrease the ticks from getting on you. When you're away, you want to check your clothing. Make sure nothing's crawling on you. When you get things home, you want to run things in the dryer on high for about 10 minutes. That will kill ticks. If you want to throw things in the washing machine, you need to wash those things on high. Just washing something in cold or warm water will not drown or kill the ticks. You need to have hot water. You need to perform regular body checks and check yourself and your kids from ticks. Not only the day you come back, but for those next several days, because sometimes they have attached to clothing and you may not see them until a little bit later. For pets, I recommend that you, if your pets spend a significant time outdoors, that you have your vet prescribe them some medication that can decrease them harboring ticks.
Thank you for watching Tick Talk with Dr. Jordan. Stop back in the next few days for part 2, where he will talk about tick removal and when to bring your child into the office with a tick bite. Thank you.